Prioritization is without a doubt one of the most important competencies evaluated on the NCLEX. The key here is not memorizing procedures, but demonstrating that you know what to do first in clinical situations that reflect real nursing practice. Think about your role as a nurse. During one shift, you may have 4 or 5 patients, each with different needs. Choosing the wrong patient to care for first can represent a serious safety risk. That's why the exam tests your clinical judgment. Two essential skills come into play here: Maslow's hierarchy of needs and the ABC method: airway, breathing, circulation. Before moving on the clinical examples, let's briefly review these tools because understanding their logic is what will allow you to apply them correctly on the exam. Maslow's hierarchy of needs. Maslow taught us that the human needs are organized in levels. At the base are physiological needs: oxygenation, nutrition, elimination, and rest. Then comes safety, which includes hemodynamic stability and injury prevention. Higher up are social needs, self-esteem, and finally self-actualization. How do we use this in the NCLEX? Simple. When you have to choose between addressing a physiological need or an emotional one, always prioritize the physiological and the immediate safety concerns. The ABC in action. The other pillar is the ABC. In any clinical situation, first ensure the airway, then breathing, and finally circulation. Think of it this way. A patient without a clear airway survives only minutes. A patient without adequate breathing survives only hours. A patient without circulation cannot be sustained much longer either. The order is not random. It follows the logic on life itself. Now, let's see some examples. Respiratory emergency. You have 4 patients. One with mild stable chest pain, one with infiltrated IV line, one with a femur fracture stable and in pain, and one with stridor and difficulty breathing. According to the ABC, the answer is clear. The patient with stridor. Without airway, there is no survival. Second example, hypotension versus fever. Let's look at this scenario. A patient requesting emotional support because they feel lonely. A patient with a blood pressure of 88 under 50. A patient with a fever of 38.5. A patient asking for assistance to go to the bathroom. The correct answer is the patient with hypotension because it compromises circulation and therefore perfusion of the vital organs. Fever and emotional needs are important, but they are not immediate life-threatening. Now, the third example, multiple emergencies. Imagine an emergency room with 4 patients. One with persistent vomiting, one with symptomatic hypoglycemia, sweaty, trembling, confused, one with pneumonia, oxygen saturation at 89%, one with a bleeding leg wound but hemodynamically stable. The order is: first, patient with pneumonia and low oxygen saturation. Remember, breathing. Second, patient with hypoglycemia since the brain constantly requires glucose. Third, patient with controlled bleeding. And fourth, patient with vomiting, which is uncomfortable but not immediate life-threatening. Do you notice the pattern? Every time we prioritize, we identify what threatens life most immediately. And almost always the key is to return to the ABC and Maslow pyramid. Let's see the strategies for the exam. Always identify life-threatening conditions first. Use objective data. Oxygen saturation, blood pressure, and respiratory rate are more reliable than subjective symptoms. Do not confuse pain with urgency. Pain must be managed, but is rarely the first priority. Beware of the exam traps. An infiltrated IV line or an upset patient will never come before a compromised airway. Pay attention to the keywords. First, immediate, most appropriate. Forces to focus on what is critical, not just important. Let's see some common mistakes. Focus on what looks dramatic, such as a visible bleeding, while ignoring silent hypoxemia, which is more dangerous. Prioritizing emotional needs over physiological ones, such as a calming and anxious patient, before treating one is shock. With these principles and examples, you now have a solid foundation for tracking prioritization questions on the NCLEX. Remember, physiological needs first, ABC first. Life-threatening conditions that compromise survival in minutes always come before anything else. Now, I would like to ask you, how did you do with the examples? Were you able to identify who to care for first using Maslow and the ABC? If you want to keep practicing more clinical cases, strengthening your reasoning, and build confidence in your preparation, I invite you to enjoy to Enfermeras en USA, where we transform study into confidence and real results.